The effects of inequalities on health are many, and there's good evidence for this as well, because we have a number of national reports, starting with the Black Report and the Aitchison Report, which highlighted the inequalities, particularly related to physical outcomes of health, such as cardiovascular disease, in terms of people getting heart attacks and stroke. And it was shown that people in the higher groups were less likely to get these than people in the lower socioeconomic groups. And in fact, further reports have come out during the past decade which have highlighted this and again emphasized that these trends, the differences between the higher socioeconomic groups and low socioeconomic groups, are increasing. The gap between them is widening. So they are worsening, although the overall trends may be coming down. Migrants are at a higher risk, and the evidence for this is particularly comes from migrants who've been here for the last 30, 40 years, because we have better data for them. The recent migrants, unfortunately, we don't have good quality data for that. But yes, they are at higher risk. And again, the evidence base for that is particularly for cardiovascular disease. Particularly for the physical conditions such as heart disease, stroke, diabetes, the health promotion messages apply to all community groups, although certain groups are more susceptible. So the emphasis on reducing your weight within the appropriate range for your weight, increasing physical activity, fresh fruits and vegetables, reducing salt in your diet, looking after your blood pressure and your diabetes, taking the appropriate medications. These are the individual things which are within the remits of the healthcare sector, but the wider determinants, which are outside on education and housing, we have to work as a community to tackling those. In terms of access to the NHS, the primary first point of contact is the general practice. And here we do have to get this message through that everybody is entitled to services within primary care, whether they are refugees or asylum seekers or settled here for many years. They have access to primary care. In secondary care, there are certain legal issues, but I'm sure the other speakers will talk upon those